Post-traumatic stress disorder, PTSD, comes with a myriad of symptoms, not least of which is trouble sleeping. On today's episode, we will look at some of the symptoms of PTSD and how best to overcome them. I'm Jay, and this is Somnilopod. Hello everyone, welcome back. I am so glad that you decided to take a few minutes to join me. I have some interesting information for you today. Today we're going to be talking about post-traumatic stress disorder. Now, post-traumatic stress disorder, PTSD, has been around for as long as humans have experienced trauma. But it wasn't until 1980 that it was formally recognized by the American Psychiatric Association. But terms like shell shock and battle fatigue have been around much longer. And if those terms remind you of a certain situation, then you're not far off the mark. Veterans, especially those that have seen combat, are up to 23% more likely to experience PTSD within a given year. This number drops to about 6% of the general population in the United States. Now, PTSD encompasses a range of symptoms that can occur after experiencing trauma. Trauma being defined as a deeply disturbing or distressing experience. It can range from the loss of a loved one to an automobile accident to being in a combat situation. Now, going through trauma is not rare. About 60% of men and 50% of women experience at least one trauma in their lives. While there may be some crossover as to the type of trauma, women are more likely to experience sexual assault and child sexual abuse, while men are more likely to experience accidents, physical assault, combat, and witness death or injury. Not everyone who experiences trauma develops PTSD, however. Approximately 12 million adults in the United States have PTSD in a given year, and this is only a small portion of those who have gone through trauma. There are a number of factors that can increase the chance that someone will develop PTSD, many of which are not under the person's control. For example, if you are directly exposed to the trauma or are injured, you're more likely to develop PTSD than if you are a witness or a bystander. Interestingly enough, symptoms of PTSD can occur within weeks of the trauma, or they can lay dormant for years until there is a triggering event. One of the frequent symptoms of PTSD is trouble sleeping. Sufferers can easily develop insomnia, which is the inability to get to or stay asleep, and affects a person at least 3 nights a week. Also, recurrent nightmares affect PTSD sufferers. And when you look at the structure of their sleep architecture, you see changes there as well. Sleep architecture is the distribution of sleep and sleep stages throughout the night. And with PTSD sufferers, we see decreased overall sleep time as well as decreased REM, or rapid eye movement sleep. And as you might recall from previous episodes, REM is a stage of sleep where we experience most of our dreaming. And some scientists feel that one of the aspects of dreaming is to help us process emotionally latent dream content. We also see an increase in limb movement activity throughout the night that can disrupt sleep. We also see an increase in the incidence of sleep apnea. And this is particularly interesting because researchers are unsure as to the prevalence of sleep apnea, whether it precedes PTSD in their patient populations. Many of the studies regarding PTSD are performed on veterans, a predominantly male population. And since men have a higher chance of developing sleep apnea, it's not outrageous to see this as a coincidence rather than as a causal relationship. There are a number of methods to treat PTSD, ranging from therapeutic to pharmaceutical. However, the best treatment for sleep issues related to PTSD continues to be cognitive behavioral therapy for insomnia, CBTI. This is a talk therapy and is often recommended in place of medication because it is not only more effective at treating insomnia than medications, but it offers much fewer side effects. CBTI has also been shown to reduce the number of nightmares an individual experiences and the stress they experience related to those upsetting dreams. It's offered in a variety of methods, from face-to-face visits to online therapy sessions. So if you or a loved one is experiencing issues because of PTSD, contact your healthcare provider. There is relief out there for you. You can also check out resources from va.gov, that's the Veterans Administration here in the United States, as well as adaa.org, the Anxiety and Depression Association of America. I hope this information has been helpful to you. I know it was interesting for me. If you have questions about this or any other sleep-related issue, please reach out to me. You can touch base with me at j@somnilopod.com. You can also reach me at the socials, either on Instagram, Facebook, or YouTube. Now, until we talk again, please remember to try to keep sleep a priority. Thanks so much.